So today we're taking the unprecedented step of declaring a local emergency. As mayor of the city of Brooklyn Center, I find the following local emergency exists in the city of Brooklyn Center, Minnesota. On March 11th, 2020, the World Health Organization determined that the COVID-19 outbreak constitutes a pandemic. On March 13th, 2020, President Trump declared a national state of emergency as a result of the pandemic. On March 13th, 2020, Governor Tim Walz issued Emergency Executive Order 20-01 declaring a state of peacetime emergency to address the COVID-19 pandemic in Minnesota. The governor's executive order triggered activation of the city's emergency management plan and enabled the city to exercise its emergency powers. The spread of COVID-19 in the United States and Minnesota has raised serious public health concerns and resulted in a great deal of uncertainty. Much remains unknown about this virus and how it spreads. Minnesota Statute Section 12-29 authorizes the mayor to declare the existence of the emergency, to invoke necessary portions of the Emergency Operation Plan and the Pandemic Response Plan, and to authorize aid and services in accordance with jurisdictional agreements. Minnesota Statute 12-37 authorizes the city acting through its governing body to enter into contracts and incur obligations necessary to combat the disaster by protecting the health and safety of people and property, and by providing emergency assistance to the victims of the disaster, and to exercise the power vested by that section in light of the disaster without compliance with time-consuming procedures and formalities otherwise prescribed by law. I, as mayor, find the emergency is sudden and could not have been anticipated. As mayor, I find that this situation threatens the health, safety, and welfare of residents of the community and threatens the provision and delivery of city services as a result of the emergency. I also find that the emergency poses the risk of and may cause catastrophic loss of public health, safety, and welfare if not immediately addressed. Therefore, as mayor of the city of Brooklyn Center, I do hereby declare a local emergency exists effective immediately on this date, March 17th, 2020, in the city of Brooklyn Center. I further declare that the emergency declaration shall continue and remain in effect until the state of Minnesota peacetime emergency declaration is withdrawn, provided the city council consents to extend this declaration as provided in Minnesota Statute 12-29. The city's emergency operation plan and the pandemic response have been activated, and the portion of the plans necessary to respond to and recover from the emergency are being implemented, including, but not limited to, all appropriate community containment and mitigation strategies. To the extent normal state laws and city policies and procedures impede an efficient response or compliance with federal and state directives and recommendations, the city manager and emergency manager and their designees are authorized to suspend compliance with those laws, policies, and procedures, and to take those actions necessary to protect the public health, safety, and welfare. In accordance with the latest advice from health professionals, events and other social interactions involving gatherings of 5 or more people need to be avoided. Meetings of the City Council, the Economic Development Authority, and other boards, commissions, and committees of the city are canceled through the end of April 2020, except that special meetings may be called if needed to conduct business requiring immediate action, provided they are conducted by telephone and other electronic means in accordance with the statement issued on meetings. Effective March 18, 2020, all city buildings except the police department are closed for the public until April 1, 2020, or until further notice. Essential services will continue without interruption. The city shall explore options to utilize city resources to provide assistance to emergency food agencies and other community agencies to serve city residents, including the immediate allocation of financial assistance in the amount of $10,000 to each of the following food assistance organizations: Community Emergency Assistance Program, CEAP, CAPI, and West African Family and Community Services. The city shall utilize city staff and vehicles to support the effort to help deliver food to those in need. The city manager shall work with city staff to establish a program allowing city employees to volunteer to use city vehicles to deliver food, following the most current recommendations and health safety precautions. All city departments are encouraged to evaluate and recommend to the city manager resources that can be acquired and deployed for the purpose of aiding the residents, workforce, and visitors present in the city during this emergency, including but not limited to ways to support the elderly and other vulnerable populations within our community. This situation is evolving quickly, and the city will continue to monitor the needs of our residents and the advice from health professionals. The city will take additional actions as needed to provide updates as we work together as a community to address this emergency. I'll now call on our city manager, Kerbogany, to come and give an update on some additional steps we've taken as a city.
Thank you, Mayor, very much. As the mayor indicated, the city has taken a number of steps since the declarations have occurred. And even before the declarations occurred, the city had already started reviewing its pandemic plan. As the mayor pointed out, the city does have a plan in place, though we are constantly looking at it, modifying and adjusting it. But one of the first steps that the staff did in terms of determining what are we going to do and how do we make our decisions under the plan is we developed 7 guiding principles. And I will summarize the 7 guiding principles in this manner. The first guiding principle is that whatever we do, we want to err on the side of protecting the health and safety of our employees. The second guiding principle is that if we're going to err, we're going to err on the side of protecting the health, safety of those that we serve. The third guiding principle is that we will be proactive, we will be responsive. And the fourth is that we will keep everyone informed. The fifth is that we will be transparent, we will be honest, and we will be factual in our decision making. And the next is that we will empower our employees to act when it's in the health and safety interest of our team and in the interest of those who we serve. And the final guiding principle is that we must act now. All of these actions are based upon one simple premise, and that is we have to do whatever is necessary in order to bend the curve down, to slow down the continued transmission of the virus. So that is the reason that we've taken the actions that we have taken up to date. Specifically, as the mayor pointed out, on March 13th, we closed the community center for 2 weeks, and we expect that will continue for the next several weeks. In addition to that, the open house that was scheduled for Centerbrook, that was immediately rescheduled. The Earl Brown Heritage Center, all the meetings and all the events were immediately canceled for 2 weeks, and we anticipate that will continue for the next several weeks. As the mayor pointed out, we have all of the public buildings beginning tomorrow will be closed to the general public. Our staff will be working. We will be available by email. We'll be available by telephone. Business can be transacted online, but the general public access to our government buildings will be closed on Wednesday, with the exception of the public space at the police department, that will continue to be available with its normal hours. And I should also add that includes the liquor stores of the city will also be closed beginning tomorrow. And as the mayor indicated, we continue to communicate with each other to determine what additional steps need to be taken. And it's an evolving situation, and we will do everything we can to keep you informed of the actions of the city and make sure that we provide you with the information you need, because our goal and our intent is to continue to provide the essential public safety and other services. We want to make those available to the people that we serve. And with that, I'm going to introduce our Emergency Management Coordinator, Mr. Todd Burke.
Thank you, City Manager. To be prepared for this pandemic and the communication pipeline that we can send out, a suggestion would be to go to our city's website and sign up for Notify Me alerts if you haven't already. To help ensure a safe and healthy space for all, please remember these following tips provided by the CDC for prevention of COVID-19. Maintain a safe social distancing of 6 feet. Avoid touching your eyes, nose, and mouth. Stay home if you're sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Get enough sleep to help stay healthy. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Wash your hands often with soap and water and for at least 20 seconds, especially after going to the bathroom, before eating, or blowing your nose, coughing, or sneezing. If soap is unavailable, you can use an alcohol-based hand sanitizer. For more updates on COVID-19, please use the following resources. The website for the CDC, Minnesota Department of Health website, Hennepin County website, and the state of Minnesota has set up a hotline for general questions about coronavirus. The phone number is 651-201-3920. Turn it back to the mayor.
All right. You know, one of the things that we're doing as a city is coordinating and working with all members of our community, and we are partnering with 3 organizations that are, some of whom are represented here today, that are going to share with us the steps that they're taking to respond to this crisis. It's very important that we as a city leverage the resources that we have to help the organizations in our city that are helping other people. And so today we have the executive director of SEEP. Claire, you want to come on up and share with us what the work that you're doing?
Thank you, Mr. Mayor. SEEP is a familiar institution in this community. We've been here for 48 years, and most folks know us by SEEP, but our real name is Community Emergency Assistance Programs, and never has that been more descriptive than where we are today with this true emergency. I know it's the first of our lifetime, in my lifetime, and we are responding to the best of our ability in these uncertain times and uncharted waters. SEEP is still moving forward with our core programming. And we are first and foremost a safety net organization. We are there to catch people when they are in need. And when in these uncertain times that becomes more and more prevalent. Our mission is to make sure that our neighbors feel safe, nourished, and loved. And we'll continue that as we move forward. However, SEEP has always been an extraordinarily relationship-based organization, and while that is still important to us, Under these circumstances, we are trying our best to mitigate the amount of times that we are with and see and touch people. So we have changed our outreach. We do still operate our food shelf, and will continue to, but rather than operate it as a market, we will operate it as a drive-up service. And as things progress, we'll continue to reduce the amount of touch points. We do pre-pack food for families size, whether or not you have children, if you have any dietary special needs, and then we'll make sure you get that food. And we will be doing 2 weeks of food at a time for folks, including shelf-stable, as well as lots of fresh produce. We think that it's important to make sure that people are getting the most nutritious food, because the more nutrition you have, the healthier you can remain. With that, we'll also have an assortment of non-food items around personal care and things that people need, especially if they're at home and unable to leave. We also have a very active Meals on Wheels program, and it's something we've had for decades. We will continue that, but again, Meals on Wheels, the heart of that program is that daily interaction with our neighbors, with our senior or homebound neighbors. And in this case, we feel that daily interaction, person to person, is not where we need to go. So starting tomorrow, we will deploy 2 weeks of meals at a time. 5 can remain refrigerated, 5 can be frozen with all necessary components, juice, milk, and any other additional groceries folks need, especially seniors who are unable to leave home. We'll also make that available to people who may enter into quarantine, so that we make sure we have those prepared meals if needed. We feel that those core programs will be the best. All other programs are suspended. We do have some emergency funds around housing, but they're limited, and we'll just make sure that families stay stable in these times. What we ask the community to do is to continue to do as instructed by the city leaders, which is follow the CDC health guidelines, stay home, stay healthy, and we ask the community to support us at this time more than ever. We have very faithful support from this community, but now we will need financial support in order to continue to keep this capacity going, especially with our seniors who are so in need of our care. So if you have extra dollars, no matter how little, we ask that you make a donation, and we appreciate that kindness and that consideration as we move forward. We've been here for 48 years. We hope to continue for another 48, and I think together we can weather this storm, and we appreciate it. Thank you.
All right. Thank you, Claire. Also today we have with us Edmund from the West African Family Community Services organization, which is housed at the Brooklyn United Methodist Church. And so we're also partnering with this organization to help serve the community. So I invite you up to say a few words.
Good afternoon, everyone. And before I say anything, I want to take this initiative to thank the mayor for coming up with this bold decision in this time of crisis. On behalf of the board and the staff, I say thank you for the City of Brooklyn Center, all the leadership for coming up with this idea. The West African Family and Community Services started about 5 years ago. It was originally programmed from the Greater Minneapolis Council of Churches that seeks services for West Africans. Unfortunately, the program ended due to funding. I was the director running the program. With the cry from the community, we came together and started this program on our own. The purpose of the West African Family Services is to seek and improve self-sufficiency of low-income African immigrants and others by serving as a focal point for comprehensive family services. We do run 3 basic services, and one of them, the core within our community where we live, is culturally specific food for African. Culturally specific food chef. Stuffs that we eat back home in Africa, when we come to here, it was hard for us to find it. So with the program, people now get what they eat, and it's available for them. Before I proceed, we all know what is going on now. And I say again, thank you, the city, for coming to our aid, because this is going to a long way to help families in our community. As you know, schools are being closed, children are home, parents, no daycare, their hours are being cut. Yes, this is the time they come to us. Within the past 2 weeks, our numbers have increased amazingly. Families are knocking on our doors for food, and we have extended our hours, open our doors, and our model, you go in there, we stay back, and you shop what you need. We don't just pack stuff for you, what you don't want, but you shop what you need. We allow you, we give you the time, and we are open, and anytime you need food, we don't tell you come 2 weeks. Anytime you come to our end, we'll give you food. Once again, I want to thank the mayor and the city council members, the leadership, for this noble idea, because this amount that you guys have provided to us is going a long way to provide services, especially food, for our community. Once again, I want to thank you, and God bless you guys all, and God bless the United States of America. Thank you.
All right. Thank you, Edmund. So in closing, I want to say that, again, just to reemphasize, it's incredibly, incredibly important, as we've heard from all of our state and national leaders, that we take this pandemic very, very seriously. And as we heard from our emergency manager, Fire Chief Todd Burt. Couple of statements from Dr. Anthony Fauci, the national expert on infectious diseases. He, as many of you know, has urged all Americans to hunker down and to take extreme measures to stem this virus. And in fact, he has said that, we'll be thankful when this is all over if we do hunker down and take these extreme measures. We know how critically important of a time that we're in right now. So I want to reinforce that message to folks in Brooklyn Center. Take extreme measures. Don't leave your house if you don't have to. And let's use this time to spend time with our loved ones and our families. And remember that you are part of a community that is being proactive and that is actively engaged in preparedness. Keep in mind that today's updates might not be tomorrow's answers, but that the city will continue to monitor the efforts that we're taking in relation to those values outlined earlier, and we're going to keep you up to date on this very rapidly evolving coronavirus pandemic. So let's all work together as one community, and we will get through this, we will survive this. But best to all of you, Brooklyn Center residents, and stay safe.